If you suffer from a radius fracture down at the wrist, I'm going to show you some tips to improve your range of motion, your strength, and return the function of your hand. If you've had a radius fracture down here on the wrist and that is healed up, maybe your physician told you just to go home, find some resources and go through some exercises, just kind of work your wrist and hand to get back that range of motion and strength. Well, I'm going to show you some tips you can do to do just that. The first thing we got to work on is range of motion because we're going to be pretty stiff going into what's called wrist extension, wrist flexion, deviation, which is side to side, and then supination, rotating that palm up in a lot of cases is also going to be very stiff because more than likely you were in a cast, maybe you had surgery, you have hardware or internal fixation in there, maybe plate or some screws. So we want to work on that range of motion first to get that restored. So the first thing you're going to work on is wrist extension. You can do this a few different ways. I've got my palm would be facing down. I'm going to take my other hand, pull my wrist back. I feel that stretch here on the bottom of my forearm. I'm going to hold that stretch maybe between 20 to 30 seconds and then relax. And then I'm just going to repeat that. Go all the way 20 to 30 seconds and relax. Now, if you want to make this stretch a little more productive, when you pull back your hand in this extended position here at the wrist, if you will contract these muscles on your forearm. So if I just contract these muscles, it's going to pull my wrist back just like that. So I want you to think about contracting these muscles. You pull your wrist back as far as you can. Maybe it only looks like this. And keep contracting these muscles while you're applying that stretch on this bottom side. That a lot of times will do better because of a process called reciprocal inhibition. So if I'm contracting these muscles back here, then the muscles that are the antagonists that work the other side, they're going to relax. Because if they didn't relax, you would not be able to pull your wrist back. So you're just going to work through that stretch several times a day. Another way that you can do that is you can go palm up and pull the wrist down like this. You can do the same thing and just contract those muscles on the back side, pulling the hand down and then applying that stretch. Then we're going to go into wrist flexion. Now, wrist flexion typically is not as limited in a lot of cases as this extension, but it can be limited. So going into wrist flexion is down this way. So you're just going to take your other hand and push down. The same thing, if you contract these muscles on your forearm here, if you make a fist and kind of bring your wrist down, you can feel those muscles kind of pop out there. So you're going to contract those muscles, pull your wrist down, keep that contraction held, and then just apply a little bit of what's called overpressure, apply that stretch, and that does really nice. You'll also have to be a little cautious. You may get a little pinch in here, maybe uncomfortable. If so, just back off your stretch a little bit, that's fine. And then radial and ulnar deviation. So this is ulnar deviation this way, radial deviation this way. And a lot of times this is not super limited. It's going to be some limited, a little difficult to kind of stretch your hand. So radial deviation would be I'm going towards my thumb side this way. So I'm going to stretch that a little bit and apply that overpressure. Again, same thing. If you contract the muscles in the direction that you want to go, the muscles on the opposite side are going to relax. I'm going to go into that radial deviation, then I'm going to hold that stretch, and then I'm going to go into ulnar deviation, so going towards my pinky side here, ulnar deviation, and then apply that stretch. And I'm thinking about contracting these muscles that would pull my wrist and hand in that direction. You just repeat that several times a day, just kind of throughout the day, just to try to work on that range of motion. Another great way to add in some range of motion, kind of a stretch with that, is to put load through it. So put this tension through it. What you're going to do is go up to a table or a countertop, whatever is a stable surface. We're going to say it's my right wrist is the one that's affected. I'm going to put that down. I'm going to stand up and kind of lean over. I'm rocking forwards or leaning forwards. As I lean forwards, I'm getting a really nice stretch. I feel that on this other side here, the forearm side, or the front side of my forearm. When I go into that stretch, it's kind of leaning forward and back. I just call this wrist rocks. We're going to go forward as far as I can this way and back. And that really works on wrist extension. It's a little difficult to go into wrist flexion and do that. That's uncomfortable. You may kind of strain your wrist or sprain something in your wrist if you do that. So I don't really recommend that. But for going into that extension, because a lot of times pulling back in that extension can be limited with those distal radius fractures or radius fractures at the wrist. So I'll repeat that for maybe 10 to 15 repetitions a few times a day. Now we're going to use a dumbbell to work on wrist extension, flexion, and radial deviation. So I have a blanket here rolled up. You can use a towel, a blanket, whatever you have, a small pillow. I'm going to rest my forearm here. I'm going to work on going back into wrist extension. So I'm going to pull that back and then back down. Nice, slow, and controlled. I'm going to pull it back and back down. Now, a lot of people ask, how heavy should I start with this? Heavy enough that you can control the weight, but you really feel these muscles working here on the top side of the forearm, what's known as the extensor muscles here. And usually I have patients perform that for 2 to 3 sets of 10 to 15 repetitions. If it's so that you don't have a heavy enough dumbbell to really challenge the muscle, what I would have patients do is pull this back, and maybe we hold this for 3 to 5 seconds, something like that. You really feel that up here, and then come back down. You just repeat the same thing. Just bring it back as far as you can, hold it there, and then come back down. Flipping over to wrist flexion. So now we're going to do wrist flexion or wrist curls, and we're going to curl up just like this. You're going to feel that on that flexor mass side right here all the way down. You're going to curl that up. And again, same thing. If you don't have a heavy enough dumbbell, you can just do some static holds here. We can just hold it in place and then come back down. So 2 to 3 sets, 10 to 15 repetitions of that. Now we're going to work on radial deviation. So you're going to hold this initially just, how you would normally hold the dumbbell. Eventually, to make this harder, you can grab the bottom part of the dumbbell. So I'm going to show it just in the kind of the center first. So you're just going to come back, pulling the wrist back into that, almost like you're hammering what's called radial deviation. So I'm going to grab the bottom here and kind of show you. This gets harder if you grab the bottom for sure. 2 to 3 sets, 10 to 15 repetitions. And then we're going to work on supination. So what supination is going to be, I'm going to start in neutral here. And so supination is flipping so the palm would be upward. So my palm is facing, just kind of neutral position here. My thumb is pointing upwards. And so this would be supination. My palm is going to go up, and pronation is my palm is down. And the way that I remember that in therapy school is palm side up would be more sup or supination. And then if you flip over pronation, put the sup down. That's how I kind of remember that in school. So what you're going to do here is just go over into that supination, flip all the way over into pronation, back over to supination, 2 to 3 sets, 10 to 15 repetitions. Now let's make this harder. We're going to grab the bottom here, and then we're going to go over to supination now. Now that gets a little tricky. And then back over to pronation. If you don't have a dumbbell, I've had patients use a small piece of PVC pipe or even a hammer. A hammer works really well because you can kind of adjust where you grab the hammer on the handle of that. And that works really well. You could even take this over into a stretch and just hold that stretch. Maybe the last repetition, you hold it for 20, 30 seconds if you can hang on to it, and then just put it down in. And you can repeat that for several times. But that is supination and pronation using the dumbbell. Now we're going to perform static holds using an exercise band. I like to do this because we're working on the strength with the dumbbell, and you're also working on strength with the band. But I like to go through these static holds to really see what kind of endurance or capacity we can build in those muscles, because there are times where we need to stabilize and maybe hold something up. Maybe it's a picture, or you're going to put on the wall, or a board. Maybe you're going to nail up a board, or it could be anything that you're sustaining that workload, carrying groceries into your house. So what you're going to do is we're going to start with extension first. So I'm going to put this band across the back side of my hand here, hold the bottom, and I'm going to pull back in extension, and I'm just going to hold it. And I'm pulling on the band, and I'm going to hold that. And I'm going to try to hold that maybe up to 30 seconds. If you can't go 30 seconds, just do what you can. Maybe you do 10 seconds, and you repeat that for 2 or 3 times. You can go more if you like, and repeat that several times a day. Again, we're trying to build more capacity or endurance with this exercise. And we're going to flip this over and go into flexion the same way. So it's across my palm here. You can take it out over the fingers, just whatever you like. And I'm going to hold this here, and I'm going to go into wrist flexion. And I'm pulling down, sustain that workload. Same thing, I'm going to feel this in my muscles. It may start to burn there. That's okay. And you're going to hold that the same way. And just repeat that throughout the day. And that's one of those that's not overloading the tissue too much. And it's kind of like the stretches and the range of motion. The more you do that, the more capacity or ability to sustain that workload are you going to build. Now we're going to use one of my favorite products. This is the Alpha Grips extension bands. I really like these. They come in sets. This is number 1. There's a 2, a 3, and so on. And you're going to go out into finger extension. We can work just finger extension. We can work finger extension and wrist extension at the same time. You're really going to feel this in this extensor mass of your forearm back here. This is also a good exercise tool and technique if you're having things like lateral epicondylitis or some sort of tendinopathy issue on the outside of the elbow, tennis elbow. It works really, really well. You're going to repeat this for 2 to 3 sets of 10 to 15 repetitions, and you can perform that a couple times a day. Now we're going to perform grip strengthening. We definitely don't want to leave that out. This product's by the Alpha Grips company. I like it because there's a dial on the end here. You can adjust the resistance level, and also has this counter button, so every time that you squeeze it down, it counts and you can see what number of repetition you're on in the screen. So just going to put this in the hand here and go through your exercises here. I like to perform this maybe 2 to 3 sets, 10 to 15 repetitions. If you don't have one of these that's adjustable, maybe you have one that's a little too easy, then just do the best that you can with it. Go back into those static holds if you need to, just squeezing and holding that down. If you don't have one of these at all and you need something that you can use, a lot of times you can roll up a washcloth or a small hand towel and just work on squeezing that. I know there's really no way to grade that resistance level with that, but that's still better than nothing, and you're really working those forearm muscles on this side here as well as finger flexors. Just a great way to exercise to get everything back moving. I always like to include some sort of manual therapy technique. This is a scraping tool by the With Ease company. I really like this because this has a kind of a grip on it where you won't drop it. So if you're using lotion or an emollient, you can really hang on to this. We use a lot of these different products in my clinic. I definitely like this one. I like the ergonomic handle. You can kind of move it around here in different areas. It fits really nice. So with this, I'm not pushing hard. I know that some clinicians like to push very hard and bruise people and make them red. And if you do, that's fine. That's just your preference. My preference is just to go easy with this. Number one, to help work on for some pain modulation, just to kind of make the area feel better, relax some of the tissue. And the other thing is to try to provide that kinesthetic awareness, because we've had an injury here, we've had inflammation here. So I don't want to kind of have too much disrupted cortical mapping, so to speak, of this whole area. So I just like to go over the area a little bit, kind of stimulate all the receptors. And again, it just feels pretty good, just nice and relaxing. Go over the whole area. I'll spend 4 to 5 minutes doing that at least once a day. The last thing we're going to do is utilize the pulse devices. This is a really neat system. They have a free app that you can download. Works with most of your, your phones, your smartphones and everything, tablets. And I'm going to put this, it has an adhesive backing on it that is reusable. You can get more of those. They also have straps. You can strap these on if you don't want to use the adhesive. And I'm going to put this on an area, say here on what's known as the volar side of my forearm here. And you turn this on, you use the app, you can set it for all different types of settings. For localized vibration therapy, these vibrate, just to give that kinesthetic awareness and input. You can also use these while you're exercising, going through your dumbbells, your grip strengthening, whatever you want to do. You can put it on the back side here to go on or go through wrist extension work, your finger extension work, just let that run. Also, it feels pretty good as far as a pain perspective. So it's helping to modulate the pain. This is not a TENS unit. It's not putting electrical input of any kind into the body, but it is using that vibration. And it does feel pretty good to help modulate tone, provide that kinesthetic awareness. I really like the pulse device system. I'll put a link for these products in the description if you want to click on them and check them out yourselves. Thanks so much for watching. I hope this video helps to improve your range of motion, strength, and ability to return function of your hand. Thanks so much.